Good afternoon. My name is Donette Morris, and today we will be talking about mental health in the Jamaican society. Mental health in Jamaica is often something we do not talk about.
As most of us may know, historically, mental health has not been a major priority in Jamaica. But since the COVID-19 pandemic, it has drawn public and political concerns.
Today, we will be embarking and speaking about 5 major mental health issues that affects the society. The 5 major mental health issues that affect Jamaica are anxiety disorders, mood disorder, schizophrenia or psychotic disorder, dementia, and post-traumatic stress disorder. These are all major mental issues that affect Jamaicans.
The first disorder that we will look at today is mood disorder, one that affects the Jamaican population.
Mood disorder is a psychological disorder characterized by the elevation or lowering of a person's mood, such as depression or bipolar disorder, hostility, changes in appetite or weight, difficulty concentrating, ongoing sadness, or feeling empty, being in an anxious mode. These are all symptoms of mood disorder. According to Hopkins Medicine website, there are several ways persons can treat mood disorder. 2 major ways are antidepressants and mood stabilizing medicines. With psychological help and of course some pretty decent routines such as keeping away from stress, avoiding alcohol, writing down things that affects you, and talking to someone you can trust. These are ways in which one can definitely treat mood disorders.
Dr. Sadara will now talk to us about anxiety disorder, another mental disorder that affects Jamaicans.
According to the World Health Organization, anxiety disorders refers to a group of mental health disorders characterized by feelings of anxiety or fear. Now, some of these anxiety disorders may include post-traumatic stress disorders, obsessive-compulsive disorders, we have phobias, we have social anxiety disorders. Now, in simpler terms, anxiety is basically a body's natural response to stress. It is a feeling of fear or apprehension about what's yet to come. So simple things such as doing a job interview, giving a speech, or even your first day of school. Things like these may cause you to feel nervous or fearful, and that is quite normal. Now, what I normally tell my patients is that anxiety becomes a disorder or a condition when it lasts longer for than 6 months, or you see it start to affect your day-to-day life. Now, that's when you may have anxiety disorder. Percent of any given population. They typically affect women as twice as often as men. According to the Pan American Health Organization and the World Health Organization, approximately 4% of Jamaicans do suffer from anxiety. It is most common in those aged 35 to 59 who suffer from anxiety disorders at higher rates than any other age groups. However, in most new cases of anxiety disorders appear in Jamaicans those aged 20 to 35 years. Anxiety feels different depending on the person experiencing it. Feelings can range from butterflies in the stomach or a racing heart. You might feel out of control, like there's a disconnect between your mind and your body. Many people who were diagnosed with COVID-19 over the past year and a half have reported a variety of long-term symptoms. The conditions that they have received the most attention focuses on the physical effects of the virus, such as shortness of breath, fatigue, even cognitive deficits. However, for some, there are other lingering symptoms that can affect their mental health. While it may be difficult to determine if these mental health symptoms emerge in patients as a result of neurological reaction to the virus or due to the stresses of them contracting the virus, it is nonetheless still important to raise awareness of the issue and provide resources to get these individuals the necessary help. Some of these symptoms may include, increased heart rate, as I mentioned before, rapid breathing, trouble concentrating, difficulty falling asleep, feeling faint or dizzy, shortness of breath, even numbness and tingling. Apart from medicinal treatments, simple things such as lifestyle changes can be an effective way to relieve some of the stress and anxiety you may cope with. Apart from medicinal treatments, simple things such as lifestyle changes can be an effective way to relieve some of the stress and anxiety you may cope with in your day-to-day life. Most of the natural remedies consist of caring for your body, participating in healthy activities, and eliminating unhealthy ones. Some of these natural remedies includes getting enough sleep, which is very important, meditating, breathing exercises, listening to music, talk with someone you trust, staying active and exercising, eating a healthy diet, having your breakfast, your lunch, eating some fruits, staying active and working out.
Dr. Alison Clark will now speak about schizophrenia, another mental issue Jamaicans face.
Greetings everyone, my name is Dr. Alison Clark. Today I'm here to talk about one of many mental illnesses, schizophrenia. What is schizophrenia? According to medical report, schizophrenia is a chronic severe mental disorder that affects the way a person thinks, acts, expresses emotions, perceives reality, and relates to others. Though schizophrenia isn't as common as other major mental illnesses, it can be the most chronic and disabling. Schizophrenia can be caused from genetics, brain chemistry and circuits, brain abnormality, and environment such as viral infections, exposure to toxins like marijuana, alcohol, or highly stressful situation. The primary medication used for treatment in schizophrenia are called antipsychotics. These drugs do not cure schizophrenia but help to relieve the most troubling symptoms such as delusions, hallucinations, and thinking problems. Thank you.
As we're coming to an end to this documentary, Miss Ashley Richards will now tell us about post-traumatic stress disorder, another mental health issue that affects Jamaicans.
Good morning, everyone. My name is Dr. Richards. I am from UWI. I'm a psychologist in training, and today we'll be talking about PTSD. I did an interview with a sufferer of PTSD and how they choose to go about it. PTSD is also known as post-traumatic stress. It is caused by childhood traumas, mistreatment, war, and can also be conflicted by otherworldly emotions such as disownment, abandonment, and abuse. PTSD caused by exposure of traumatic events or frightening experiences such as sexual assault and natural disasters. PTSD comes in a lot of forms, and one form is also called CPTSD, which is called the critical post-traumatic stress. It's actually caused within the moment, and it actually transpires over time. Unlike PTSD, where it actually takes a period of time for it to happen, to build up, to cause those traumatic experiences to conflict one's life. For instance, the interview that I got to do with a survivor and sufferer of PTSD. Some questions were, what are your PTSD triggers? The client said clicking, pushing back of their head, and loud bangs. I asked what caused their PTSD, and it was caused by gang violence and childhood traumas. Does your PTSD affect your personal life? They said yes, the sounds of clicking can send them in a frenzy. Now, as you can see with this interview that was done, it affects their everyday life, so they can't live normally because of the gang violence there and their childhood traumas that also affect them in their now adult life. PTSD can be clinically treated by antidepressants and therapy.
Last but not least, Miss Kitania Anderson, guidance counselor, who will be talking about dementia. Another mental issue that affects Jamaicans.
Hi everyone, my name is Kitania Anderson, and today I will be teaching you about dementia. According to the National Institute on Aging, dementia is the loss of cognitive functioning, thinking, remembering, and reasoning to such an extent that it interferes with a person's daily life and activities. Symptoms of dementia. What are some signs of dementia? Difficulty speaking, memory loss, wandering around and getting lost in the community, repeating questions, and losing balance are some of the signs of persons with dementia. What is dementia? Dementia is more common as people grow older. About 1/3 of our persons of age 85 or more may have a form of dementia. Now, we'll be looking at 2 solutions of dealing with persons with dementia. The first solution will be ensuring that they have a healthy lifestyle. And the second one is providing a comfortable and safe environment for persons with these sicknesses.
Taking care of one's mental health is very important. As you can see, that there are so many different disorders that can affect us as Jamaicans. So, next time you detect that there might be something wrong, never be afraid to get help. Never be afraid to get further information on how it is that you can actually help yourself. So, now that you're mentally aware, share the word so someone can know that mental health in Jamaica is real and that there are help out there for you and for me.